Welcome to Mejo's docuseries on health entrepreneurship. Entrepreneurship in healthcare is vital for addressing Africa's unique challenges and creating sustainable solutions for communities across the continent. In this series, we explore the journeys of three extraordinary leaders: Dr. Clarke, an Irish-Ugandan physician, entrepreneur, and philanthropist who founded the Kiwoko Hospital and the International Medical Group in Uganda; Dr. Mapham, a South African ophthalmologist and founder of Vula Mobile, the oldest African health tech company connecting hospitals to specialists; Antony Natif, a Ugandan pharmacist, activist, and founder of Garden Health Pharmacy, one of the largest with over 19 stores. Their stories reveal the lessons, challenges, and triumphs that define healthcare entrepreneurship in Africa. Through their experiences, we aim to inspire the next generation of changemakers in healthcare. Every journey has its share of setbacks. Mistakes, failures, and lessons learned are critical parts of growth. These leaders share the valuable lessons they've gained and how they have shaped their journeys forward.
So I had treatment for about 6 months. I then was in the position where I had seen people die of HIV. I had experienced the dread diseases. I'd experienced it myself, where I was almost going to die. And I felt I couldn't just go back to being a regular GP in suburban Ireland or England at that time. So that drove me to come back out again, and I did a master's in public health. And then subsequent to that, I came out and just started a clinic in Kampala, so like many doctors. So then that over a number of years developed into, first of all, International Medical Center and then International Hospital, and I spent I started various business aspects of it. So that's sort of broadly what I did, and then subsequently, more recently, I've diversified in business and I've started a coffee farm. And we have this university and we have school. So over the years, I've become more entrepreneurial. And when I came to Uganda, then some of that experience, and this is one thing I've learned in life: always take the season you're in, and then always try to garner as much experience and learn things from that season, and you will never know when that will become useful. I just finished reading Steve Jobs' autobiography by Erickson, very good biography, by the way, and the story is told of how Steve Jobs, when he went to Brook University, he wasn't a good student. He didn't settle. In fact, he left university, but then he used to go back. He hung around the university and he used to go back and do classes, and one of the classes he did was in calligraphy. And that resulted in what we have now in all the different font styles and so on in our keyboards. And you think, well, the different things that Steve Jobs did contributed to his life in different ways. And you see that, and I think that's a lesson for us all to take. Whatever season you're in, get the best. I'm always telling my staff, it's not about, you're just here and picking up a pay packet. How are you developing as an individual in this particular season, this job that you're in? So when I finished the Kiwoko project and I did my master's in public health, and my kids were then back at school in near London, then it was a question of, now what do I do? Because it was, it would have been easy for me to become a family doctor again, live in suburbia. And yet my experience had all been dread diseases, HIV, Africa. So coming back out again and starting a clinic was a difficult decision, because it wasn't it wasn't obvious. So that's always a question: how you move on to the next step? Do you give up what you're doing? This is your project, and a lot of people want, they call it founder's syndrome. You need to hold on to that thing, or you're prepared to move on to the next thing. And I think I've always been prepared to move on to the next thing. But moving on to the next thing is often, sometimes you're not sure what it is. There wasn't any private hospital at that time. And I started saying that, and there was a lot of clinics, but they were very lousy quality. And things like hygiene were very much lacking. So I felt, you know, this may be poor, resource limited country, but it doesn't mean that you have to be second rate, you know. Developing country doesn't mean second rate, it doesn't have to. Yes, I can't put in the latest MRI and stuff, but I can do evidence-based medicine. I can do best practice, I can do good hygiene, you know. It doesn't take money to do that kind of stuff. So I thought if I did that, it would also be in terms of quality, it would be setting standards for how private hospitals should develop. And that's actually what happened. And there was many people who worked for me and worked in the organisation. Now, I mean, in terms of X-rays, reading X-rays, it's a given. In terms of AI now, it used to be, you see, in machine learning, you needed to have thousands and thousands of X-rays. But now with artificial intelligence on top of machine learning, you know, you can actually reduce that number till you get, you know, it's known in skins, in dermatology and in radiology, and that probably goes through to MRIs. You're talking about stuff you're doing in digital technology with malaria, reading malaria. It's more accurate than human beings. So, does that mean doctors are not needed? Well, we need to work then in the context we're in, which is the digital age, to see how we can be the most effective. Because what people are saying, we're really at a crossroads in terms of AI at the present time, because it's becoming powerful by the day. And we don't have a decade to think about it. It's literally in months. And the guys who are talking about AI, like Sam Altman, he's or Suleiman, you know the guy Suleiman, he started. Suleiman is an English guy. He started the company in DeepMind or something in London. But you see, somebody like Sam Altman is talking it up because it's just so incredibly amazing, and it's making them billionaires. But how are we going to use this in things like healthcare? The two fields that are the most advanced at the present time are AI, which is built in digital technology, and biology using digital, using those tools. Biotechnology, thank you very much. Biotechnology. Those fields are crazy scary. Yeah? And so there's where you need to be looking. The interesting thing is, you see, you can sit in Uganda and still be, you know, you can read about them. I know all this. I know this stuff because I read a lot, and I use audible books as well if I'm on a long journey. So, in the same way as mobile phones leapfrogged landlines, AI, digital technology, AI, biotech is leapfrogging the traditional medical stuff, and you've got to get yourself into that way of thinking. If you don't have failure, if you're in a sort of safe place you never want to fail, then it's hard also for you to learn. I failed so many times. I mean, I would say the business that I did when I was a family doctor in Ireland, because I said I did some business there. When I came to Uganda, I realized how much I'd learned from that business and I could apply, but at the time, I had to, you know, we overtraded. I had a number of retail shops. We had to rationalize that down to one. It was tough. It was really tough. I didn't fail in the end, but you know, I felt like I failed. I made investments that, you know, didn't. You know, I bought medical equipment that just sat there. You know. Was something wrong with it, didn't work. That we should learn to listen to other people. If you're a risk taker, you're like, this idea is going to work, this is good, this is good. But wait a minute, you may think that, but if you read about biases, there's very good books on biases. Black Swan is an interesting book to read, and there's other ones. And you realize I'm biased. I'm biased toward my good idea. I will automatically think it's good. But then talk to the people in the field and listen to them. Don't just be biased and you know, I know better. People. You're talking about building a team. You build a team, you build trust, then you put trustworthy people. You met Patricia over there in the other office. Patricia handles hundreds of thousands of dollars for me, and I don't need to worry about it. Yes, I look at management accounts. You know, I do you do the checks and balances and stuff like that. We have authorizations. I have to, but I don't need to. I'm not sitting there having to run the detail because I have someone who has worked with me for now 10 years. Again, came straight out of university, learned the business, did a master's after that, learned the business, and now she can run the whole business side of the farm. Tess does my diary and stuff like that. We have an accountant who's a group accountant. So I've put people in. I mentioned Rose, who's the vice chancellor of the university. So I've put people in who run different parts of the business, who I trust, and I trust them because I've worked with them and they know my values, you know, and they don't want to let me down, and they don't, and they themselves then get well paid for what they are doing, and they have a loyalty to the organization, and they still have the vision for the organization. So you know, I just don't think there's an easy way in life. I think you have to have grit. You have to take advice from other people, because you know, there's been businesses I've done, and if I'd taken advice, you know, I would have maybe left them. You've got to be prepared to fail, and you've got to learn from your failures. You've got to be prepared to start again in many contexts, and you've got to build on all the knowledge and stuff that you've had from the past.
We did outreach. We drove about 4 hours to one of the clinics, and there was a patient there who was actually a healthcare worker, and she had a huge tumor on her eye, and a conjunctival tumor. And if she had only been able to use something like Vula then, she would have been treated possibly even a year earlier. And I think it was things like that where I realized we have to do something. We can't just let this continue as it is. We have to find a solution. And at the time, Blackberries were the main cell phones. So the first version of Vula was actually on Blackberries, and then that translated into, you know, launching on the main app stores, which you see today. You don't necessarily have to have one friend. So at the beginning, this is just my journey. We did a bit of programming on our own, but then for 4 years, I outsourced the development, and it was kind of like pay as you go. I took a long time to choose which company I would work with, and eventually selected one. And what we did then was, as I had more money, I could pay more to have more features, which meant that they maintained the code, maintained the database, and I didn't have to employ one person, which was obviously, you know, high risk. So I think that may be one option for people here, but it's not a long-term solution. So in 2019, we switched from being outsourced code development to having our own technology team. But if you've got young people listening or wanting to learn, just go and do it. Find a way to make whatever you want to do. It doesn't have to look pretty or anything, but just test it as soon as you can. And that doesn't require that much funding. If you want to build a whole company, that's a different question. I think that one of the things I learned was that when in that 6 months I took off as being a doctor, I did a course called Lab to Market. And Lab to Market was actually for engineers and for scientists who were busy coming up with inventions and creating patents, and then wanted to go to market with their invention, literally lab to market. I think I was the only medical person on the course. And what was so interesting is that during the day, they would give us lectures on, well, first of all, you have to raise money from friends, family, and fools. And then you have a seed A, and then you have a seed B, and this is how it works. And at the end of the day, they would invite an entrepreneur who had actually made it and had a successful company, been in existence for more than 5 years, to give a presentation. And none of them had done it that way. So all of them had found a unique way of starting their business and making it work. So the way that I've started doesn't mean it'll be the same for you. Each of you will find your own way. And there are some principles, but I think that just because they're rules doesn't necessarily mean you have to follow them blindly. I think that if you ask people for advice, people will help you on your own journey. And I think it took me a long time to learn to ask for help more. And if you look around, there are a lot of organizations that will help you. There's the Health Tech Hub in Rwanda and Kigali, for example. That's just one. And also just reaching out into the ecosystem, people like me or others who can help guide you on your journey, because I think each of you will have an individual one. I love reading about behavior change. I think it's harder in practice, but luckily that TV show that I worked for, their whole focus was on behavior change. And there are lots of different ways you can try and achieve it. My favorite technique, if I had to choose one or recommend one for people to learn about, is something called motivational interviewing, which is basically how do you ask questions that change behavior. And it's not always around having an answer. It's about the process that happens after you ask questions. And in terms of behavior change with Vula, there have been so many examples. One example is that because everything is recorded, suddenly now everyone is accountable. So one of the professors, for example, looked at all the referrals that went to his department, and he said to the team, look, I've analyzed all your responses. You're giving incredibly good advice, but you're not being very polite. So he then wrote operating procedures, not around the clinical side, but actually around the language to be used when people are referring into you. So suddenly you now had people being more polite to each other. You're increasing trust between healthcare workers. It's not necessarily what we built Vula for, but it's been a side effect of what's actually happened. The other thing we do is we publish the response times from every specialist to every team. And so suddenly there's now accountability on how fast you respond to a call. And of course, you can't respond immediately. That's not what Vula is designed for. Vula is a sort of asynchronous way of contacting people. But now people actually are able to record their response time and publish their response times and actually say, look, we're a good department because our response time is really good. So I think that it has created behavior change in the way that people communicate. It's created behavior change in how fast you can connect specialist services to rural healthcare workers and to GPs. And so maybe those are the two best examples of behavior change that I've seen through Vula. The long-term ones are so interesting. So what we saw is that there were a lot of referrals from one of the rural areas down to where we were working. And then that happened for like 2 years and then it just stopped. And so we phoned the healthcare workers to see if they were okay. And they said they were fine, but they knew what to do now. So they hadn't been to any courses or learning or anything, but they'd learned case by case by case. And now you actually stop the referrals coming from the area. All the patients are now being treated on site. They got really clever. They used the data of all those referrals over the previous 2 years to motivate to the Department of Health why they should have a better clinic in that area. And if you go there today, it's a really state-of-the-art clinic and patients are being treated there. So I think that's kind of a long-term part of value or behavior change that's happened through Vula. So sometimes you build things and then you're not really sure what will happen next, but those are maybe 3 examples of what we've seen.
our grandmother, because I was forever on her lap or by her side in the evenings, cooking and all that stuff. She believed in being yourself, whether you had money or not. So for her, you could lose everything or you could make everything. But if you didn't lose yourself, you were rich. So that had a way of grounding you as an individual. You got comfortable having nothing, because having nothing didn't change you as a person. When I say having nothing, I'm speaking from a point of privilege, because nothing doesn't mean I can't eat, I can't do what. But you learn not to worship wealth. And so if you're comfortable with having nothing, it means as a business person, you can swing for the fences, because zero is your comfort zone. So you're not worried about losing everything. And so that built a huge risk appetite in me that, from my story, you can tell almost lost me the company and everything we had worked hard to build. But it also allowed, if you swing for the fences, you can miss or you can hit. And so if you bet on yourself and buy that ticket, most likely there's a chance you're going to win that lottery. And that's how it's been, through taking massive risks. Sometimes a lot of them not informed by any particular data, ultimately paid off in some way. A lot of those risks I wouldn't have taken if I wasn't comfortable with losing everything I had. So that's a life lesson I'll probably take to my grave. The other one was, I knew fairly quickly that I wasn't the best at doing stuff, and I have a very low attention span. I will think about many exciting things and get them started, but then quickly get bored by finding another exciting thing. So my work around that has been to find a way to always get the best talent, get them to buy into the vision I'm building, show them the ropes, get out of the way and become a cheerleader. So in Guardian, my job by the time we exited that company was essentially pass coffee at the office, listen to like 20 minutes of the numbers from my team. And as a vision holder, you never lose that sharp mind, because you've run this company from being a sweeper to being the guy who carries the boxes to being the HR to be. So you're familiar with all the facets of the business, but you may not be so good at the nitty-gritties. I knew that for sure. And it didn't hurt me admitting that other people could do it better. So that humility, I probably couldn't have had without the benefit of, being in business from early on. And so it allowed me to get other people into positions of authority, and then I step aside and just make sure I equipped them and supported them through their work. It has worked, and I think it can work for anyone. It works as a charm. Then treating people with respect. My favorite person in Guardian. Okay, I had like 5. But one of my favorites was the border guy called Roger. He still is there. I met Roger in our first week in Kampala along Muyenga Road. And he was going about his duties as any border guy. So I had to deliver a product to a client, so I stopped him. And I also had meetings after that delivery. I'm like, okay, tugende. He stops, he was wearing a green shirt and what, big size. So I jump on his bike and we move. We deliver the product. The client delayed me, gave me tea. It was just up there in Muyenga. Gave me tea, and she engaged me in conversation, how we do business, what we hope to do. She was a successful business person, and she's seeing this young man hustling. He's from the University of Washington. Why isn't he back there doing his, rich people things like educated people? Why is he jumping on borders to deliver Panadol and Augmentin and whatever? So she found it fascinating. So we stayed long, but the story is about Roger, not the client. We stayed longer than we should have. Come back, jump on a border, we go some other place. So in total, we spent like 5 hours with him. So after he brought me back to the pharmacy in Kabalagala, I'm like, how much do you want to be paid? He's like, give me 15,000. In my head, I'm like, I've spent a lot of time with this guy. He deserves at least 50,000 shillings. So I'm like, I thought you'd ask for like 50. He's like, no, 15 is fine. Let me tell you how. Why? It's like, I get this bike from my boss. So there's borders have this thing of okuvuga chibalwa. So he gets a border from someone and he gives him 10,000 at the end of the day. So then he needs to make sure he has money for fuel to start the day. He has money, he makes enough money to eat, and maybe another 10,000 for himself to save. So it's like, I get this bike on Chibalua. I have carried you to like 4 places. The only thing we've spent is time. The fuel I've used in total is probably 3,000 shillings. You've given me enough money to pay my boss. You've also bought me food. So the rest of the hours, I will just go back to the stage and look for 10,000 or 15,000 shillings, and my day has started. But also, if I'd driven back to Tintale, where my stage is, I could have had to wait maybe 20, 30 minutes for a client to come. I take them somewhere, they give me 2,000, I come back like that. So you've combined all this in one block. So 15 makes sense. We argued back and forth, eventually got him to accept 50. I said, okay, the rest is a gift. Next morning, he shows up to the pharmacy. He's like, you know what, I've thought about it. I see you're surrounded by hospitals. You have someone who talks to those doctors to refer prescriptions to you. The pharmacy in Kabalagala was surrounded by Chibuli Hospital, IHK, even as far back as that hospital in Bugolobi, then Zambia. Like, do you know all these doctors? Can't you get me someone? We got to talk to these doctors today and tomorrow, and then they can start referring prescriptions here, and then I can deliver the medicine. So you pay me 10,000 for the owner of my bike, 10,000 for my savings, you buy me lunch and fuel, like maybe 7,000 every day. I'm like, oh, I like how you think. I test him out. We go look for a nurse, diploma holder. Her job was to just be on this bike with him. But the first day I went with him to see the doctors. Prescriptions started flowing. He starts feeding them. We establish ourselves as guys who can deliver meds to all these hospitals. Business grows. Then eventually he comes back and says, oh, I saw a place, a pharmacy in Kansanga. They open at midday, they close at 3. I don't understand. You can take it over. Next, I stay in Chitintari, Nalavio Pharmacy Bugolobi. We buy it. So he probably helped us get half our locations. So eventually I got him he got some shares in the company. But we established a friendship. I was on the back of that border. Half the time I was in the country. And so from him I learned the importance of treating the sweeper the same way you treat the general manager of the company and the CFO. In fact, oftentimes I was more friendly to these guys than I was to the big boys. I would hold these big boys accountable to the needs of the smaller guys. And that permeated through the company, and it brought us a lot of goodwill. And it worked. When people buy into what you, the vision holder, are selling, it becomes much easier to work that way. So that's another lesson I learned growing up. I don't know what else. These are the lessons I really learned later, after we survived collapse, that it's important to have a board that can even fire you. Every day I was in Guardian. That board could have fired me from the company if they wanted, even if I as much as sneezed. Paying your employees well, coming through for them in more ways than one. So yeah, those are some of the lessons.